remember during the first lockdown, there were police cars that would just roam around announcing, go back home, stay at home, stay safe. Remember?
And the funniest part was when they started doing it in different languages, like Tagalog. Hoy, pumasok kayo ha. Sige, kuya.
It's not like that.
Hello, everyone, and welcome back to another episode of the Half a Nice Day podcast with your host, Joshua.
And Janine.
And today, we have a very big celebration, or not celebration, a commemoration of the 1 year of the coronavirus.
It's not a celebration. We hate it. We hate it.
I had to speak for yourself.
No,
I'm kidding. Yeah, it's a very bad experience that everyone has gone through in the last year.
Why are you caressing your mic like that?
I really feel this microphone today. Haven't got a lot of love and affection lately, so this
So
microphone
you're looking for it from a microphone.
Yeah.
Okay.
Yeah, but as humbling as this experience might have seemed, the whole world going into a total lockdown, everyone's in their houses, working from home, a lot of things have changed. There has been a lot of turmoil as well, and a lot of people who haven't had a good experience with this whole situation as well, since overnight the world was turned upside down. And it has affected everyone in different ways, some good as well, some bad. Businesses have been booming as well as been closing down. We realized we are all on the same ship as well, but at the same time, some people are on yachts and some of them are on canoes.
Who are on yachts and canoes?
No, let's say some people have gotten richer because of this whole pandemic. Let's say
okay.
Amazon and
Right.
Jeff Bezos. And
I mean, he's already rich before this, but I guess the rich got a little bit richer.
you know why? That's because he controls the best logistics team in the whole world in terms of delivering stuff to your door, in terms of online deliveries as well. So that also plays a big part, because if everyone's locked out at home, how will they go out? And instead, he did the work for us, and he has his team, and he has offices all over the world who can help deliver stuff to your door, whether it be essentials or even luxury goods, whatever you name it. Amazon has it. So yeah, it just really depends on the cast. I would say
The cast of...
not the cast of a TV show, like the
Yeah.
cast or the well-being of people as well, if they're able to afford it or not, if they have access to a lot of certain things as well. So it really has taken the world by storm overnight. Everything, life as we knew it, turned for the worst.
Yeah, I think if you look at it, maybe... not overnight for the whole world, but for each country, we went through different phases, right? It started with China, and then it spread across Asia, it spread across the US, and then for the UAE, we started lockdown at what, March? In March,
yeah.
20-something?
Yeah, maybe last few days of March.
Mid-March, yeah. Mid to late March,
And that's
probably.
complete lockdown as well. It wasn't a curfew. It was a complete lockdown. Like, everyone stay in your homes.
Yeah, which a lot of countries went through as well. And there are some countries who are going through their second and third waves of lockdown. And it's just crazy because when you think about it, you would have never known that was your last free day. You know, the last normal, quote unquote, normal day for you, wherein you wouldn't have to wear masks, you wouldn't have to worry about your safety, you wouldn't worry about sanitizing everything, you wouldn't worry about the welfare of your families, the elderly. That was the last day where we were living lives as we knew it.
Because at the same time, we didn't know much about the coronavirus as well. So we all thought and treated it like as a flu at the beginning. So people thought, okay, maybe once this lockdown is over, we had the national sterilization program where we thought, okay, everything's going to be sterilized. Everything's going to be good to go. But little did we know that the coronavirus is bigger than it seems.
Yeah.
Now it's mutating in itself. Second and third waves have taken over different countries. Even the developed countries are having a harder time than developing countries as well when it comes to handling the situation, because they would have never expected it that it would grow and pass on this quickly.
Yeah, if you think about the first few countries which got it really bad, Italy, France, Spain,
Yeah.
they're the ones who went into full lockdown, and they were the first ones who unfortunately couldn't handle the amount of people who got the virus. The people who were affected by the virus, and their hospitals couldn't house these people anymore. So it was sad in a way that life is very ironic. Even countries who are doing so well, countries who the third world countries were looking looking up to, were the ones who got hit hard.
You know, it also comes down to education, because in third world countries, government says this, we will do this. But now in these more developed countries as well, when it comes to education, they're like, why do we have to do this? And they start challenging stuff, and they're like, no, I want my freedom. I want to go to the coffee shop down the road. I want to go to the library across the street. Right. And I think that's how it spreads as well.
Yeah, I don't know if I want to agree with the sentiment that with third world countries, people say yes to what the government says. Maybe not so much. Like, look at the Philippines. Everyone said stay at home, but they were still outside.
Yeah,
there were
that's
still
also
people
true.
Outside.
Yeah.
India
but also
went on lockdown, but they can't because they can't afford not to be outside.
Yeah, that's also a point to take in.
Right? They have to
their whole livelihood
literally
is outside,
fend for their families and go outside of their own homes.
Yeah.
So wasn't really their choice, but I guess it's just because these countries have a bigger population as well.
Yeah, and more dense areas as well. And then it comes to show, like, money doesn't even buy happiness. Money for them is like a security that they need.
There you go. Like when Bill Gates said in an interview, a year before this happened, what would be the next biggest problem? And he said a pandemic.
Yeah.
Like, we weren't ready for it. No one was ready for it. No one was well prepared to have their lives turned upside down in a blink of an eye.
Yeah, despite him giving a warning, they didn't take it as serious, because it all came down to the public health system. Like, especially, I'm just speaking for US, maybe other countries, but I'm not too aware of. But they didn't have the equipment, the tools, the space in hospitals to handle such a pandemic.
Yeah.
And with the US as well, with all the people and the anti-maskers who didn't want to actually abide by the rules of the government. I think those were the people. That's why it spread like wildfire, especially across US, especially in New York and cities like that. But again, like, even if their warnings are everywhere, but people really don't think that these things have such an impact, especially with something which is like a virus, which you can not easily, but you can avoid it to some extent by washing your hands, just maintaining proper hygiene. So it also comes down to that, But yeah, warnings are there, but everyone has a different opinion about it, I would say.
Yeah, maybe we can start with we're already like a few minutes in, but perhaps we can start with the current stats and where we're at right now. So there are 119 million recorded cases from when we first started this whole thing. 2.6 million deaths worldwide. 2.6 million. I can't even begin to think the families, the lives of the people who are affected by this, and the mourning of 2.6 million lives across the world. That's just crazy.
And also not being able to attend the funeral, right?
Exactly.
It has to be a Zoom.
Right. That is so... like, imagine you're, God forbid, someone very close to you, parents, family member, friend, spouse, were in the hospital and you can't even visit them because it's literally not allowed.
Yeah. Because at this day and age, anyone can be a carrier.
Yeah.
A guy who gyms 7 times in a week can be a carrier. Even if a 6 pack on his stomach and 6-pack on his arms and anything.
Why did you look at your tummy?
Yeah, just full of regret.
Were you manifesting a
I
6-pack?
was like, if I say it with so much passion, it might just happen to me. But that could literally happen to anyone. You know, person who takes care of themselves like day in and day out. He could be the next guy to have it.
Yeah, that's right. They might not be affected as gravely as someone who is a little bit older, who would have pre-existing conditions or would have something within their system that could make it even worse. But anyone could be a carrier and can pass it on to someone else. And that was the difficult part to it, because a lot of the younger generation didn't think they had to be responsible, or that they had the responsibility not to go outside, not to be with their friends, and they just didn't think that much of it until it actually started affecting them.
Yeah.
Remember when it first happened, we were talking about it, not a lot of our inner circle had it. We would hear it from, someone, a friend of a friend of a friend who was distant enough from our lives had it.
Yeah.
And then as months passed by, it would just as if it was haunting us closer and closer and closer until they were literally right in front of us. I was exposed to people who had it right in front of me.
Yeah.
That's
so true. In the beginning, people were thinking, is this thing even real?
Right. And everyone it's just the flu. I was one of those. I was like, oh, it's just the flu. We can get over it. It's just like the swine flu or the first SARS flu or whatever that is.
Yeah.
That just dissipated, and it just went off. But this one really hit us hard.
I'll tell you, its stages are literally, I know a friend of a friend of a friend of a friend who has corona. Then it becomes, I know someone who has corona.
Right.
And then when you find out this person has corona, oh, okay.
Yeah.
So it's become,
it became normal.
It became normal.
Yeah. And you just had to look after one another and are you okay? Is everything okay?
Yeah.
But what I wouldn't ever get accustomed to was going through my social media feed and seeing friends and families mourning the deaths of people in their lives.
Yeah.
Every single day I would see something.
Yeah.
And you would always associate it to corona, he or she died because of corona. Yes, this person had something else before that, but corona just took their lives away because their immune system wasn't healthy enough to battle this stupid virus, this stupid thing.
Even with regular deaths, let's say of old age or other complications, the first thing we would usually ask, was it because of COVID or something like that? Yeah, so that's also...
Yeah. It became the norm to ask, is your family okay? What happened? Was it because of COVID?
Yeah.
That's the first thing to ask. Anyway, sorry, we went off on a tangent. I wanted to go through the other stats as well. In the UAE particularly, we're at 422,000 recorded cases since this whole pandemic started. And we have, I think, one of the lowest death to recorded cases ratio. We're at 1,388 deaths so far. Mm-hmm. So thank God we have a lower mortality rate in the UAE. I think many factors. It has to do with the government was really good with handling the virus. They were quick enough on their feet to say, okay, we have to go into lockdown. They started preparing for the increased numbers of patients. They started putting pop-ups of the medical, hospital beds.
Tents and...
They turned, what was that? The World Trade Center into a pop-up hospital of some sort. So they were quite ready and quite prepared for this to hit. So they were ready to take in more patients than other countries who have a higher mortality rate. I think another thing that contributes to that is we have a much younger population than anywhere else in the world, just because UAE is a job, it's a job country.
It's a cosmopolitan country where people usually flock in. We have a massive population of expats who come into the UAE to work. So obviously they're more of a younger crowd as well, because they don't see them spending their future here. They just come here to make their money, and then
when you're done with your job and you don't have a visa, you can't really be here. So you have to leave
unless you have some I don't know.
Yeah.
You
And
bought a visa or...
yeah, or if you invested, but that's very rare. Like most of our families would come here, and then by the time that they reach the age of, not working anymore and retiring, then they leave. I have so many friends who we all grew up here as Dubai kids, and their parents are now moving to the Philippines or moving to different countries for their retirement.
Yeah.
And I wanted to stress out the fact as well, the reason why the mortality rate is way lower than anywhere else is because we started the vaccine early enough. I think we're one of the countries, I think us and Israel are the two countries who really have a wide spread of the vaccination drives.
Yeah.
We're already at 6.5 million doses given away. Imagine. That's a lot. We have a population of 10 million.
So doses meaning if there are 2 doses, so
Yeah.
we divide this
So
by
around
2.
3.25. Yeah,
3.25.
around 3 million.
Yeah.
Or most of those would probably be the first dose, but yeah, 6.5 million. That's a lot compared to other countries where the amount or the percentage of people that they're willing to vaccinate is super, super tiny.
Yeah.
And it's still reserved for people who are over a certain age, people of determination, people of, I don't know, people who have pre-existing, underlying conditions. But here, you can start queuing up even if you don't have any of these.
Yeah.
As just like a normal person without any underlying conditions.
No, but the first wave was actually for...
The first wave
yeah,
was.
but then that was over really quickly.
Yeah.
But like you said, the population of the UAE is more of a younger generation. So I think
they got through the older generation much quicker than anywhere else. And also because we're conducting testing of the coronavirus way faster and much more than anywhere else. Like if you're gonna cross the Dubai to Abu Dhabi border, you have to get tested already. In record, there are 33 million tests conducted in the UAE.
Yeah.
So if you feel any symptoms, you can just go to a drive-by Seha testing center. You can go to a hospital and get tested. I know a lot of people who actually get tested almost every week.
But that's the beauty of the UAE because they've embraced technology as the future. So they're really adopting technology, and when it comes to all of these things, like you book your appointment to an app, you do something on a website, you do literally everything through your phone.
Right.
So that also comes from doing the vaccine, that also comes from doing the test, that's also booking your slot at a drive-through. So it's everything, and they've really mastered this. Then they also put it as a tracking device when you're in quarantine to make sure that you stay put in your place. And
you get fined.
Yeah.
That's another thing. Like people are actually scared of getting fined, imagine, right?
I think that's the number one fear people have in this country.
Because the fines are ridiculous. But that is a good thing for UAE to do because...
It's a very good thing. Very good
The only reason to stop people from going around maskless is to fine them 1,000 dirhams if they're caught, right? But not even like you also. I think you can also get fined for not wearing your mask properly.
Yeah, for like half-assing it. Like if it's like here.
Yeah.
Dude.
Right.
Get your life
You'd
together.
See police like roaming
arresting
around,
and shooting this bugger.
Yeah, not here. Also, remember during the first lockdown, there were police cars that would just roam around announcing, "Go back home, stay at home, stay safe." Remember?
And the funniest part was when they started doing it in different languages, like Tagalog. Hoy, pumasok kayo ha. Sige, kuya.
It's not like that. What did they say? Manatili sa bahay. It means like stay at home in Tagalog. Manatili sa bahay. I don't know what stay safe is. I don't remember.
Ingat kayo.
Mag-ingat. Probably something like that. Good job.
Because I'm always outside.
He's always outside. And there were videos of these like police cars just roaming around telling people to, hey, go back home. And that's when the surge of all of these online grocery deliveries came out. Kibson's just couldn't handle the amount of orders that came in. Remember, you could order for the week.
See, I would tell you, I was a Kibson's user before the pandemic. And I would order in the night.
Such a hipster thing to say. I only eat
gluten. I only eat gluten-free products. I only eat anything without like any added, whatever you call it, those injections, any steroids
Hormones.
in your hormones in your.
Okay, he is very passionate about this. Knocked my mic over.
No, but I was a fan of Kip since even before the pandemic, and then come pandemic, I couldn't get a delivery on the same day, which I used to do normally. I used to get it in like 10 or 15 days after. I'm like,
Yeah.
what will I do with lemons 15 days from now?
I think that's the longest I've seen it, like 9 days, even more.
Yeah.
Wherein like you have to order now for 9 days to come. Like how would I even know what I want from 9 days from now? Like I want my order tomorrow, but of course you would understand. And these people were risking their lives literally. At that point, we didn't even know how quick it is to transmit the virus. We were all quarantining our groceries by the door, leaving it when we order something, we leave it at the door for like a day or two so that the virus may dissipate from the surface.
Or you would they would leave it there and you would spray it down.
Yeah. You would wash all of the groceries that you have. So our hygiene practices really
impeccable.
Yeah, it was. Can you remember, right? Like just before the pandemic, like you would hold a door and you go about your day. Like a handle of a door. I would never, like, me.
I would sneeze on the handle and then touch it. That was me pre-pandemic.
But you know how I was. Like even before
pre-pandemic, Janine was very OA about pressing a button or holding a door.
I would always push it with my shoulder or push it with my foot. Because I saw this documentary about germs and like how door handles are dirtier than toilet seats. And I was just like, ugh.
The dirtiest place actually in a mall, do you know?
No.
The dirtiest place in a mall where
the rail of
the railing of an escalator.
I would never, yeah.
It has traces of feces, blood, sweat, everything
because
on that.
It's true. Imagine someone who would go to a toilet, not wash their hands, and then hold that freaking rail of the escalator.
No, I hold it so I can get stability when I wash my shoes on the.
I do that, but is it really made for brushing your shoes?
Yeah.
Is it?
What other purpose does it serve other than that?
Probably brushing the dirt off of the thingy.
Yeah, maybe. Actually, that's actually really smart.
Yeah.
No, but I used to get my J's clean every now.
Yeah, but
and
if you're wearing white shoes, you would never.
I don't wear white shoes as well. So,
all right, you don't.
yeah,
right,
so I'm smart like that.
Yeah, and I was one of those who would always have sanitizers with me around.
I would never have sanitizers.
Even before the pandemic. Like, it was just that I don't know, I was icky like that. But even more so, that heightened when this whole pandemic happened. It's crazy. It's crazy. But I don't think we'll ever go back to maybe generations after us who did not live through this pandemic would probably go back to their unhygienic ways. But us, we're just like, I can never go back to like holding a rail of a door or opening a taxi door or just like holding public stuff. And not like sanitizing my hands ever. I don't think my mind is ready to go back to that ever again. Because what if there's another
strain? That's your new normal then?
Yeah, that's my new normal.
Okay.
Yeah. So
because Janine and I, we have this thing where we're the designated door opener. So if I start like pressing the elevator buttons, I have to be the one to press the other. When I get inside the elevator button, I have to press that, open the door, everything, and then at the end I'm sanitized.
Right. Yeah.
So yeah.
Speaking to your mic.
Sorry.
And it will
I'm enjoying this conversation.
I know, and it will always be that one hand. Like if you use your left hand, you have to use your left hand all throughout because I'm gonna sanitize that hand after.
Yeah.
He can't use both hands.
Yeah, and if I touch my eye, Janine will leave me.
Oh no, yeah. He always touches his eye for some reason because he has lenses and sometimes his eyes go watery. And he always like, I can't. Like he always tinkers with his eye. And I'm like, stop it. It like bothers me so much when he touches his face. Anyway, speaking of the vaccines, I got my first dose of the Sinopharm vaccine. And that was, I'm very thankful for my company.
Yeah.
Thanks to my company for having that initiative so I could bring any of my dependents or a family member with me. So I brought my brother with me. We had a little bit of a hiccup with the whole schedule and the whole vaccination thing, but I went through and I got the first dose, and my next scheduled one would be in 21 to 28 days. So that's the Sinopharm, and you have your schedule, which is in a month from now. But to be honest, like if you listen to some experts and scientists and doctors, all they say is just get your hands on anything that's available in terms of vaccines. I'm just a little bit like hesitant with the AstraZeneca one because I've been hearing a couple of people who I know who have gotten symptoms after they got the vaccine. And I think it has the lowest efficacy
Yeah,
with
and the
all of the
most
vaccines.
side effects as well.
Right. But
still,
that doesn't mean it's gonna kill you guys.
Yeah,
Yeah.
put on your big boy pants or big girl pants and get a vaccine.
We've been getting vaccines for ages now. Since you're a baby, you've been getting vaccines. Most people get a flu shot on a yearly basis, which is just a flu shot that they, how do I say it? They work on every single year for the flu variants that happened the year prior.
Yeah.
So how the Sinopharm works is it's very similar to the other flu vaccines, and they've just modified it for this particular strain of COVID or SARS-CoV virus. And I think Pfizer is the more like newer technology. And the way that you store it, it has to be negative double digits, something degrees Celsius, if you have to store the Pfizer. So it's just the way that they're maintaining these different viruses are different. But all in all, they just have one goal, and it's to make sure that they prepare the immune system from, if in case you get the virus, your immune system would be prepared to fight it off. So it's injecting you with not the strains of the virus. It's not, how do I say it? According to popular belief. Is that correct? According to popular belief. Is that how you say it?
No, it's something popular belief. Yeah.
Yeah, okay,
I
something like that.
Yeah.
A lot of people think...
Regards to popular belief?
No, I think according to popular belief. Okay. Probably, whatever. You guys know where I was going up with that, but they're not injecting the virus into our bodies. That's not how it is. If you Googled it, you'll find so much more articles and videos that explain it much better than I am saying it, because I'm not a scientist. But I've done my research, and I'd rather be prepared and have my body prepared for whatever virus it may come across with, rather than expect it to just fight itself on its own. Because I'm asthmatic, and I have bouts of asthma attacks when I was younger. I have my inhaler for a yearly or sometimes twice a year where I get these bad asthma attacks. But I'd rather be prepared. I know I'm healthy. I exercise. I eat healthy food. But I just want to make sure that I'm ready for whatever.
Yeah, that you're covered from all areas of this virus.
Right. And I really encourage people to make sure that you're also, if you're ready to get vaccinated as well, and if it's available to get vaccinated as well, because only when everyone else are vaccinated, then we can have this herd immunity type of thing.
Yeah, when everyone is safe and sound, then we can start socializing again and getting together with everyone. Right,
because I miss gatherings with families and friends, and I think the coronavirus just made it more evident with how important relationships with families and friends are. Especially when you're alone. Especially when I was alone. I was alone for the bulk of the lockdown.
Yeah.
Sorry, that's the metal straw in my glass clinking. Josh made me some iced coffee. Thank you, Josh. Wow.
You're welcome.
But yeah, I was alone for the bulk of the lockdown, and it just made me realize the importance of good relationships with family and friends. And that's what pushed me through my anxiety. That's what pushed me through.
Coming out alive.
Yeah.
Coming out on top.
Just making, like, getting through it.
Yeah, and then, a funny part as well is, like, we all took advantage of the Zoom technology and webcam. And that's how we used to do all our interactions with everyone, even when it comes to weddings, when it comes to funerals, when it comes to engagement parties. Everything was done on a Zoom platform.
Right.
So, and everyone actually missed that human interaction when I could, like, laugh with someone and then slap them on the face or do something. You know, like
Right.
like that human touch, I think, was really important. People missed out, and it led to a lot of things as
And
well. Concerts and going to the cinema,
public
and
events.
yeah, public
just
events,
being outside and
expose
enjoying
everything. Yeah,
going to the gym and being able to kill someone on the mats. When I mean kill, doing jiu-jitsu, that I really miss, and I can't practice it now because I'm just aware of the fact that you have to be very close to someone and there's sweat involved, and you can never be sure if that person is, a carrier of the virus or not. And my sister just gave birth, my grandmother is here, and I don't want to be that person bringing the virus into my family, right?
and I've spoken about this before as well. I would feel more bad about myself, and if I ever gave it to someone, than me actually enduring the whole sickness and quarantining for 14 days, and I would be
losing
it will hurt me more knowing that I passed it on to like 6 or 7 other people. Like how I won't be able to face them, I'm like, sorry, I gave you the virus, bro.
Yeah, no, I won't be okay with that. And I think another thing that we can point out is just the realization that working from home is possible.
And I love it.
And a lot of companies were very against working from home because, they're like, oh, we don't trust our people to work from home. You don't know if they'll be really working or they'll be doing something else. And I think the whole COVID situation just proved that we can actually work from wherever. And most of the jobs can actually be done at home, especially when you have a good Wi-Fi connection. And businesses were still running. Businesses were doing good. I mean, some businesses, especially the hospitality division wasn't doing that well.
For the worst. But what you said is true as well. Companies still did their whatever they were required to do. Employees were safe at home. They were doing everything as normal as they would have done in the office.
And even more, I would say, because you had more time because you skipped the commute time from and to, the getting ready time from and to, especially for women, where you have to prepare your hair, you have to put makeup, blah, 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 get yourself ready. It wasn't just a take a shower, put your shirt and pants type of situation for women. You always had to get ready. And you skipped all of that. You gained much more time and you were able to actually work for that time instead of like getting ready for yourself, right?
And that peace of mind as well, knowing that I'm looking after my kids. I don't have the nanny there as well, because I've seen a lot of people, a lot of colleagues who are like on the phone with their family. Like, is everything okay? Did you have your lunch? Did you have your breakfast? Blah, 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 blah. So when they're at home and they see their children right across them and they're working, they have that presence of mind. Like, okay, they're there, they're safe, and I'm still carrying on with my job.
Yeah. And when you had these little breaks in between, you could like mop up the floor, you can vacuum the floor, you can change your bed sheets, you can change whatever. Because at work, you would take these little breaks, right? Talking with your colleague, taking a toilet break, a smoke break, a water break or whatever. At home, you can still take these breaks, but instead of like taking some time to do that, you can do other things. Wash the dishes or whatever. So it was very home friendly, and you were able to keep your home much neater and nicer.
But you know the harder part though of working from home?
Yeah.
What excuse can you give that if, let's say you were sick?
Yeah.
Like, oh, let's say I have diarrhea. So I'm like, I call in sick to work so I don't have to go to work. They're like, okay, work from home. So does it also give you that liberty that in case you are sick to actually not do work and just rest up? Because they'll be like, oh, you're working from home anyway. Get on your laptop and do some work.
Yeah, also, but that's not fair for companies to say, I get where you're coming from, but that's not fair for companies to assume that when someone's sick, they can actually work, right? Because you're going to work from your deathbed? You're going to work from your bed? That's not okay. That's not fair. If someone's sick, they might be nauseous. They might not be able to like look at a screen properly.
Yeah, if they have a migraine, if they cannot sit upright for too long,
they're having diarrhea.
Rest.
They have to be in the toilet for like half of their day.
Yeah, just might as well put a workstation up there. Sit on the pod and like...
Yeah, but I think that's not fair. Maybe sick leaves would be less now that you're working from home, because you can tolerate, like if you have, I don't know, migraine or you can't walk, for example, you have a gout attack, you can still work. It's just you have to be seated at all times.
But do I choose to work?
That's the
That's the
question.
question. That is
Yeah,
the
but
question.
I think it all depends because you'll never know someone's pain threshold, pain level. For example, your gout attack, sometimes it goes from 0 to 100 really quick. There's sometimes where he can't even stand up. He can't even stand up from his bed, and he's like whining about the pain.
I can't stand up. I can do cartwheels if I had to, but I just choose not to because I want to preserve my foot for a very special occasion, in case I join a marathon or something. But anyway, coming
Just
back to
admit
what
that
we
you're
said.
in real pain when you have your gout attack.
Oh, I feel like I need to shoot myself in the foot or cut my leg off so I never endure this pain
I
again.
feel really bad for him when he gets his gout attacks, by the way.
Yeah.
I've heard it's really painful. I've researched. At first, I was just like, oh, he's being a baby, whatever. And then I researched it, and there are some articles comparing it to like childbirth.
And it is like childbirth.
You'll never know.
I
No,
feel
no,
a baby
no.
is coming out of my foot
You
whenever I
have
have.
no right to say that because you're never gonna shoot out a baby out of your vagine. Okay, women can
mostly
say
because I
that.
have a penis, but
Women can say that. And the person who wrote that article was a mom who gave birth.
so she knows both the feelings.
So she knows both the
No,
feelings.
but there is there's a pain scale, right? It goes from like 0 to something. And there are some instances, I would say, where the pain tolerance, okay, because the woman's birth is a very sacred event that happens. It's the miracle of life, and I would attribute it to positive pain. But this is more of a negative pain. Like, but this is something that I've.
Like you can't have the mental strength to
Yes.
to tell you this is for a good cause. Like you're feeling this
Exactly.
pain because you're shooting at a baby.
Exactly. So that also comes into play, you know. Like but then at the same time I know, like, because of my poor diet choices and my non-active lifestyle, this has happened to me.
Thanks for admitting that.
No, that's why I you know, I love women and I love birth.
What?
I love birth, yeah. I love birthdays. No, but it's two different things. And there is a sort of happiness that happens after childbirth. So you were willing to
Right.
endure it.
Yeah.
But for me, I know it's because of my poor life choices. Then that's why I sulk and then I feel bad about myself.
Yeah.
That's when I want to cut off my foot and throw it outside the window.
Yeah. You're like, this is useless.
This is useless, yeah.
I can go with one foot.
I can go my whole life in a wheelchair.
I think you'd like that.
I would love that.
And just be like wheeling life away. Be like, yes.
I would park anywhere I want.
That's so true.
Yeah. Okay, but of
Yeah,
course
but
the
you'll
people of
only miss your
determination.
foot once it's out.
That
And
is
you'll be
true,
like,
yeah.
I miss you, foot. I'm
Yeah.
sorry I cut you off.
Yeah.
And you'll regret it for your entire life. So
Or
be
like there's an
thankful.
asteroid hitting the Earth and I've nowhere to run.
Right.
I'll be like,
You'll just be
'cause
hopping away.
I'll be like, Janine, you're still behind me, and you're like
no.
miles away. I'm like,
Exactly. Because
guess.
you took away that one foot. Right? So
yeah.
take care of yourself, dude.
I am taking care of myself.
He is.
I'm
His recent gout attacks have been like lessened in terms of days because you said like the last bad one got you through
ever since I
2
met
weeks.
you. First of all, it's been happening a lot more.
What?
Sorry that just came out.
You meant it.
I meant it.
I knew it.
No, but I've been taking care of myself, and I realized during this pandemic there are a few things that you really cannot take for granted anymore. Like what Janine already mentioned, it's family. For me, it's been more about my health and what I'm doing with my life, basically.
Yeah.
Because can you imagine, like, you're in a pandemic, you're home alone with your thoughts and doing work the whole day. Because there's another thing about working from home is that you have no set time when it comes to working.
Yeah.
Like Janine and I would be working, we would start work at around 8 or 9, and then we would still go on to the wee hours of the evening and then having our dinner in front of our laptops, which is also not a good work-life balance when it comes to it. Which is something we're going to be talking about as well, a work-life balance.
Yeah. We'll make sure that I'm really working hard to making sure that I have a proper work-life balance. It's just me.
Yeah, no, because
The workaholic in
you
me.
did start a new job as well, so you
Yeah.
are trying to learn the ins and
Trying to
outs of the
catch
company.
up. I'm hiring a team and they're not yet in, so there's just those things.
Yeah, but when we have our lives together, we will definitely
Yeah.
discuss about that.
Yeah.
Yeah, but Is there anything else that you wanted to talk about?
No, I think that's just it, and just wanted to stress the importance of being ready for any situation.
Yeah.
Making sure that you save enough money, making sure that you work on yourself, being healthy, so
Yeah.
that any time, God forbid, another strain of something else comes in, our bodies are healthy enough to try and fight it off naturally until a new vaccine comes, and
Yeah.
make sure that you care, you practice self-care, because self-care is not really a luxury, and think it's something that you should be doing practicing
So true
every
that-
single day.
That's very true. It's not a luxury. Yeah.
And if you don't care about yourself, who will? So be prepared for anything that's coming in. Making sure that you can cook for yourself. For example, if times get rough and you can't order out again when another lockdown happens. So
Yeah.
just make sure that the basic necessities in life are there,
Yeah.
and that you cater towards that.
Because we actually, Janine and I, we did a podcast before of the things we learned in COVID, but we never published it because of some certain reasons and everything. But then a lot of lessons have actually come out from me spending 1 year in a pandemic, and it comes to buying in bulk, which Janine and I both do. We buy our groceries and everything in bulk. We make sure that we save money. We don't spend unnecessarily.
We make our own coffee at home.
Yeah, instead of spending like $20 in a Starbucks every day,
Yeah.
might as well buy some beans or a machine and do it yourself. It's quite easy.
You can be your own barista.
Yeah, and you can literally experiment, do what you want, add more sugar syrup, vanilla, chocolate,
Hopefully
whatever
not so
you
much
want.
sugar.
Yeah.
You don't want to fall into a diabetes trap, but
Yeah, we don't want that. We don't want that.
it's okay to splurge from time to time, especially if you've earned enough money for it. But just be wary of your expenses. Record it. We can talk about expenses as well, and how we see. This is what I was talking. Just see that the whole thing that I was talking. Look at how red your eye is.
Okay, guys, that wraps up this episode.
It annoys me so much.
Sorry, guys, it's really dry. And when I rub it, it wets up. So I'm smart and I play the rules.
I can't.
Play by the rules.
Oh man. Okay. Well, thank you so much, everyone, for continuing to listen to us. Okay, rub your eyes again now with your t-shirt. That's my advice. Like, if you want to rub your eyes, just use t-shirt or like a tissue or something, or wash your hands before you do so. Not after you've touched a million and
I think this episode is actually for me.
Yeah.
Like, everything I learned today was like,
Let me record that. Yeah, but thank you so much, guys. You've gotten us through a lot of weeks. This is episode 31, so it's 31 weeks of recording every single week and publishing content every single week. And again, we always say this, but we won't be able to do this without you, without people who are listening to us, without people who are sending us, DMing us, emailing us at halfanicedayshow@gmail.com, following us on our Instagram at halfanicedaypodcast, sending us anonymous, handy advice forms on our Google form, wherein you'll find the link in the YouTube description, on our Instagram link in bio, and the show notes of this episode. Thank you so much for listening to us on Spotify, on Apple Podcasts, and wherever you listen to your podcasts. You can also rate and review us on Apple Podcasts if you deem that we deserve the 5 stars and deserve a good review on Apple Podcasts. Please do so, because it really helps. And share our videos, our Instagram posts, our Instagram stories to your friends, loved ones. Hopefully we can bring a smile to your day, because that's what keeps us going. And if you're watching us on YouTube, please don't forget to like and subscribe and hit the notification bell to make sure that you are notified when we put out new content.
Just a side note, the like button on YouTube now has a lot of value when it comes to creators. So I would really urge everyone, if you really did like the video and if you really want to support us, please do like our YouTube videos. Our podcasts are over there if you want to see us visually. And is there anything else?
No, that's it. So on that note, have a nice day. You're off note. Thank you so much, guys. We love you.
We like you as a friend.
Bye.
Bye. See you next week.